So Amy, why do we do the research that we do? Why do you think it's so important?
So malaria remains a really important global public health problem. There's hundreds of thousands of deaths every year, and despite the fact that we've seen significant progress over past decades, that progress has really stagnated. I think the end goal of this research is a world free from malaria, and this would be an important step in that process. We have 2 vaccines, which is really exciting, but they have modest efficacy, which wanes over time. So what it really requires is a creative, innovative approach to tackle this convergence of threats that we're seeing as the parasite adapts to the challenges that we throw at it in all of our interventions. And so we really have to come up with solutions to tackle this incredibly devastating global disease.
And so, Amy, what are we sort of investigating with the NIH funding we've received?
So malaria vaccine development is really complicated, and the parasite has this complex life cycle. So really our goal is to understand in endemic populations with all of this diversity and all of these different variants, how that impacts the efficacy of future malaria vaccines. And we don't just want to understand that, but we want to really understand that early in clinical development so we can make sure that ultimately the vaccines that we develop in next generation vaccines are as protective as possible for the most people possible.
So Amy, I've seen really big successes in my research, but what do you sort of see as the big sort of successes overall in the lab or anything sort of exciting in the pipeline?
One of the things that's been really exciting for me to see is with this whole approach of really partnering together with our partners in Senegal and doing this research alongside is being able to test these things, these scientific hypotheses that we come up with in the field and in real time. And I think if we look at some of the data like that you have generated, being able to identify novel variants in these vaccine candidates and being able to look at the way that some of the work that you've done, being able to test antibodies from vaccinees and see how well they work against these diverse parasites in patients, the ones that are actually causing disease and causing death, has been a really critical approach. And this is something that no one else is really doing quite in this way and will be really important if we want to ultimately develop a vaccine that will save lives for malaria.